Hello, it's Andriana here, and this episode of The Juggle is Real is such an important one to listen to. So I'm so grateful that you are carving out the space to tune in and to listen about perimenopause and the juggle and how we are navigating midlife and our health. I'm so grateful for the time that our guest shared with us today. You're really in for a treat because Dr. Sarah Shaw is my guest for this episode. And Dr. Shaw is a lifelong advocate for girls and women. She's so passionate about illuminating health issues for midlife women and is really committed to raising awareness for improved menopause care. She is one of the founders of Lume, which is a private women's healthcare clinic located in Toronto, and you can find them online as well. But prior to starting Lume, Dr. Shaw spent 15 years running a family medical practice in downtown Toronto and also serving as chair of the board of directors at Tattle Creek Family Healthcare Team. Her career began with a foundation in social work, leading a community organization to improve the health of individuals involved in sex work in Nova Scotia. In addition to her medical degree, Dr. Shaw has a doctorate in human development and psychology from Harvard University and has her MSCP designation from the Menopause Society. She has East Coast roots. She is a Canadian through and through. And Dr. Shaw now lives in Toronto with her husband of 3 decades and her 4 sons. She's a mom of 4 boys, my friends. She loves her early mornings to fit in exercise as much for her brain and her mental health as for her cardiovascular and bone health. And she loves to enjoy that first morning latte with her cat, Persephone. Nothing makes her happier than enjoying athletic pursuits with her 4 sons. In today's conversation, we are going to be looking at understanding perimenopause and menopause a bit better, learning exactly what these stages are, some of the symptoms that women exhibit. We're going to be debunking some of those myths and misconceptions that are out there and really empowering you with more knowledge and some support, as well as practical strategies for managing perimenopause and menopause. This is a beautiful and such an informative conversation. I can't wait for you to tune in. So let's get started. Hey, I'm Andriana Gonco, and this is the Juggle is Real podcast. As I share my ongoing journey from experiencing burnout to leading a more mindful and intentional life with better balance, I hope you feel seen, that you realize your worth, lighten your load, and prioritize your own needs. As we hear from leading experts and well-known faces in the wellness, entrepreneurship, education, and motherhood space, I hope you gain insights, proven practices, and learn actionable tools to help you enjoy the juggle of work, family, and everything in between with a little less stress and a lot more ease, joy, and fun. Most of all, I hope you find what you need to simplify, streamline, and supercharge your own journey of better balance and self-love. Are you with me? Let's get started. Dr. Sarah Shaw, welcome to the Juggle is Real podcast. Thank you so much for making time to speak with us today. How are you doing?
I'm terrific. It's so nice to be here today. Thank you for inviting me.
Now, I have so many important questions to ask you today, but before we get into all of the juicy stuff, I would really love to get to know you a little bit better. You're doing the most wonderful things right now, and you've had such a beautiful journey starting in social work and family medicine and a lot of advocacy work, raising your 4 boys alongside your husband, and now founding Lume and becoming a menopause care expert. So, can you share a little bit about who you are and your journey so far?
Thank you for asking. I guess I would first say I didn't plan out my life. Like I can remember in high school a moment where I said, I'm just not a science person. I don't need to do any sciences. And boy, did my life change after that. I think my real passion was in working with children and women and in advocacy and talking about things that we don't do a very good job talking about. So each season of my life has ended up being dedicated to a different dimension of like the biopsychosocial. And I feel like where I am now in my life, those are all interrelated. They're all very important dimensions of where a person is. And I love that I get to work with all three of those things every single day. That is a part of, if you really want to do a fulsome assessment of where a woman is in her life, it's really looking at the biological, the psychological, and the social. So I did start in social work. Actually, I have an undergrad in women's studies and philosophy. I then I worked in community organizing. So I ran an outreach program for women involved in street prostitution, really around issues of violence, assault, health, access to health care. And that spurred me on to think about I need some more specific skills on being a psychotherapist, really working one on one. So I ended up going to Harvard because there was a whole group called the Psychology of the Girls, the group on the psychology of girls and women, and they were looking at women's psychological development in a whole new way. So Carol Gilligan, who produced some seminal work called In a Different Voice, this was many decades ago, and she was one of the first psychologists that looked at these, pardon me, there were these theories of moral development that were purported to be universal. And in fact, they only talked to boys and women. And of course, women came up looking not very mature. They didn't look so great when you used a lens that wasn't built on their lived experience. So she spurred a movement about what do we learn about the psychological landscape if we actually ask girls and women about what's going on in their lives. And she really looked at that period of adolescence. So I spent that time of my life really focusing on that transition from childhood to adulthood, adolescence. And I focused on girls who cut themselves and how did that speak to the culture? How did that speak to the changes they were going through in their lives, which is a very specific developmental time. And when I would ask these young women where they first went for help, every single one said their family doctor. Now, they typically never, in fact, did they get the kind of help they hoped for. But it made me think I need to understand the biological piece and what a wonderful entry point if we really want to think about prevention and early intervention. As a family doctor, you get to do a little bit of everything. You see these people all the time in many different periods of their lives, and there's not a stigma to accessing care. Pardon me, like there is not as much anymore, but as a social worker or a psychologist, for some people, that's a barrier to accessing care. So I ended up going to medical school. I've been in a practicing mainly children and women in downtown Toronto. And when I started my practice, I was having babies of my own. The women I was seeing were wanting to get pregnant, having babies. I took care of those babies. It was really wonderful. There was absolutely nothing more joyful than getting to do well baby visits. And like that first visit when a parent brings in a child it's a tremendous privilege to be
Mm-hmm.
to share in that family's journey. And then about 16 years later, all these women and I, all these patients and I, we had all moved into perimenopause and menopause together. And even though I'd focused my life on women's health, it was so clear when I was in that position myself and when I was trying to be agile for my female patients in responding to questions about perimenopause and menopause that we have not served women well in that space. There's on average, sometimes even less, 1 hour in medical school training. So
Wow.
we are half the population as women, and we will spend half of our lives peri or postmenopause, and we get 1 hour. So the reality of the lack of education, the lack of attention was so stark that I was like, I need to make a change. And I think for a lot of midlife women, I was just able to raise my head from young children. I still have children. I still have children who need lots of care and nurturing, but it's different than when they're, 1 or 2 or 3 and you're in the diapers change. And I'm very grateful that I met with 3 other women who were also able to just raise their heads from those early child rearing years and and say, I want a career pivot for the last chapter in my career. I really want to do something that's incredibly meaningful, where there's a lot of opportunity to contribute, and there is a huge space to fill in women's health.
I agree. So much to be learned, so much research that has yet to be done. And I'm just so grateful that there are people like you and your partners and Lume who are now putting a closer lens on such a an important part of a woman's life, because I'm certainly not an expert, but I'm a little bit more aware of perimenopause because I recently turned 40. And I have beautiful friends who are just a little bit later in life than I am, just a little bit
Mhm.
older. And so the topic of perimenopause and menopause has come up for me in my life a lot more recently. And so I am looking into a little bit more. And there's so much that we're going to talk about, but just to begin, because I want to make sure that we're all on the same page here, especially for the listener who might not be as familiar. Can you just share, like, what is perimenopause and then what is menopause? I think we've all talked about menopause in terms of like hot flashes, but what are those two distinct periods?
So if we think about premenopause, like in our in our reproductive years, for most of us, not all, but you're having regular cycles, you're having regular periods, which are, around 28 days. That doesn't speak to all women, but it speaks to most women. That's what's happening when you're in those years where you might be fertile, interested in having a baby. And then in perimenopause, instead of having a regular cycle, your hormones are really fluctuating up and down. They become incredibly erratic. And that is what causes a lot of the symptoms. That is perimenopause. That's for most women, that is in your mid to late 40s, and it can last 4 to 7 years. Menopause is a clinical diagnosis, so you do not need blood work. Typically, we don't need blood work to address the question, am I in menopause? It's when you haven't had a period for 1 year. Now, if you have an IUD in, it's a slightly different question because you're probably not getting periods. But for most women, it's perimenopause is that 4 to 7 years where your hormones are all over the place. Menopause is when you haven't had a period for 1 year, and then everything after that is postmenopause.
Okay, that's good to know. I have heard, because we don't know when that menopause is actually going to occur, right? And it can be in your early 40s, late 40s, early 50s onwards. However, the symptoms that you're referring to with the hormone changes, what age do women typically begin experiencing that? Like you're saying in that around that 40s age, but can you explain how the hormonal changes during the transition can impact our lives? I mean, it's one thing to say the hormones are up and down, but is it impacting our energy levels, our mood, our overall health? Like what is happening during that period because of the hormone changes?
So I would say everybody experiences perimenopause differently. And there's a small percentage of women that really sail right through. Like maybe they had really difficult periods. They're like, I am happy to be done with that. There's a small group who really truly suffer and suffer for prolonged periods. And then there's the middle group who typically do have symptoms and there's some variation. There was a study that came out this past summer in the Menopause Journal, and it said that 63% of women report during perimenopause, I just don't feel like myself. So I think often it can be somewhat gray and nebulous, and sometimes it's you're piecing the puzzle pieces together in retrospect. So it can take a
Mm,
little while. So oftentimes you have sleep disruption, but you're not sure why you're having the sleep disruption. If you have a classic hot flash, like you break out and you have a bad hot flash and you break out in a sweat, then it's obvious. But lots of women are having hot flashes that do not register in your brain in the same way because you're not breaking out in a sweat. So it may
right.
be I talk to lots of women. They'll say, "Oh, I don't think I'm having hot flashes," and then I say, "Well, tell me if you have a bed partner, do they have the covers up and you have the covers down? Do you want, are you having battles over the thermostat control? Are you wearing less to bed, or do you have a sheet?" And then everybody else in the household, has their covers pulled up. So maybe you're not having terrible hot flashes that you're sweating, but you're still having a temperature regulation issue. For a lot of women, they describe brain fog, muscle and joint pain. Changes in your cycle are really classic. So typically, the changes in your cycle are that your periods may actually get closer together. So your body is trying to push you like ovulate. See how many times you can ovulate. Let's see. Your body is sensing it's at the end of this reproductive cycle. So you might actually ovulate more than once in a month, which can be very confusing, especially if you've had and very challenging intellectually, but also emotionally. If you've if you've struggled with fertility challenges, if you've had babies later in life, then it can feel like you've gone from breastfeeding straight into perimenopause. It can feel
Mhm.
like you have these when your hormones are all over the place, you have extra estrogen on board during perimenopause. It's just like you're pregnant. Like you may be doing pregnancy tests, so it can be very confusing. Muscle and joint pain would be another one.
Okay. I mean, I think there are so many myths and misconceptions out there that it can be a little bit confusing. And like you've mentioned, it's not the same for everyone. And there's not like one way that you're going to know for certain that that's the cause. So when it comes to perimenopause, you've mentioned some signs, some symptoms. Are there certain things that maybe are overlooked? Because I think, yes, the hot flashes, that is the one that we in society know to be the obvious version. But I was recently at a gathering of all women, and we were playing a game, and all of a sudden, my sister-in-law was like, "Is it hot in here? Don't open the window." Like it was
Yeah,
very, very
yeah.
spur of the moment. Nothing had changed in the physical environment or even in like the discussions or what we were doing. And just it was very, very sudden. But I think, like you've mentioned, it's not always that obvious. So are there some things that we might overlook or confuse with that everyday stress or the busyness of life? Or some, you've mentioned some women are having children later in life, so they might be mistaking it for, that brain fog or just being busy with your children. So is there a way to tell um, if it's more related to perimenopause or if it's just, you might need to reduce the stress in your life or make some changes based on just your lifestyle?
So cycle changes is the biggest one. Like as soon as a woman says, "Is this perimenopause? Could this be?" I ask, "What's your cycle like? Has it changed? Were you always regular and now suddenly your periods are coming closer together or they're further apart?" That would be the number one piece. And then it's really taking a detailed history. Like what are those other symptoms that are coming along? And
Okay.
sleep,
Okay.
sleep and cycle.
Okay. Are there any of those big myths or misconceptions about perimenopause or menopause that you would like to set straight? Things that you hear often that are just so wrong that you just want to make sure let's all get on the same page here when it comes to this stage.
I think the pendulum has really swung back and forth in terms of hormone therapy. So there was a study that came out in 2002 called the Women's Health Initiative. And it grabbed a lot of headlines. It was very sensational, and really scared women. And then suddenly hormone therapy went from being the most prescribed medication in the world to plummeting. And women were all taken off hormone therapy. Doctors were scared. Women were scared. I remember my one lecture in medical school on hormone therapy was in 2002, and it was take all women off hormones. What I heard, that was it. I didn't hear anything else. It was like, they're bad. You don't need to know the details. Don't do it. And now the pendulum has swung the other way. So you might be seeing all over your social media feed, hormones are important. Hormones prevent dementia, all kinds of reasons why every woman should have hormones. And I would say that is a myth. It also drives the idea that if you can't take hormones, if for some medical reason hormones are not the best choice for you, it makes you feel like you have missed an opportunity or suddenly your life is going to go all downhill. And I would say there is a very important place for hormone therapy. I prescribe it every day for the right person. It can make a huge difference, and it is certainly the gold standard in treating vasomotor symptoms, which are like hot flashes. Absolutely, it helps prevent osteoporosis and fractures. There's some primary indicators where it does an excellent job, but no one pill is a panacea. So it's always about attending to the whole person. And you may be on hormone therapy, but if you have really poor nutrition, if you never exercise, if you don't get enough sleep, if you're unhappy because you don't have meaningful activities and relationships in your life, the pill is not going to be the answer. So I would say hormones are very important. They can be helpful, but they are not the whole story. It's always looking at that biopsychosocial. And I think one of the big myths I'm coming up against these days for the perimenopause period is sometimes women feel like they may have been dismissed when their family physician may have given them a birth control pill. And I would say that we have newer birth control pills, and they can actually be, it is different than menopause hormone therapy, but birth control pills can be very effective in controlling all those fluctuations in the perimenopause period. So it's important, and we have newer birth control pills that are actually, even if you don't need it for contraception, can be very helpful in dealing with those fluctuations because it actually stops ovarian functioning and then it replaces a steady dose of hormones, which can really help with symptoms, including mood.
That's so, so interesting. I think what I'm hearing a lot is just the awareness factor and just being able to empower women like you're doing, to be able to empower yourself with the knowledge and to have that support, because there are a lot of things that we can be doing in practical ways as well as medical ways to manage these symptoms, whether we are in perimenopause or postmenopause. So what would you say are some of those really realistic and actionable steps that we can take, even in our busy lives with our schedules? You mentioned, there's not one pill that's going to fix everything, but the biopsychosocial trifecta that you've discussed, perhaps you can delve into that a little bit more, that can support us with the fatigue, the mood swings, the sleep disturbances. I've recently joined the weighted vest club, and I'm often talking about
Awesome.
it.
So
Loving my
good.
weighted vest. Yes. And I share it kind of funny, jokingly, tongue in cheek. But can you share how important the nutrition aspect, the exercise, the sleep can be, and provide any specific recommendations that you might have?
I would be happy to. Thank you for asking. And I'm glad you have a weighted vest, and exercise clearly has an important role in your life. And if I had to give one recommendation, like I used to feel like as a family doctor, I should just go into the waiting room and just spend 3 minutes talking about exercise. It would be probably the biggest bang for your health buck that I could do. And I would still say that's true. If I had to give, what do I think is probably the most important thing we can do for our health, in terms of longevity, in terms of health span, it would be exercise. And it's because exercise impacts all those other areas of your life. So we know that, for example, if you have mild to moderate depression, that exercise can be as effective as traditional antidepressant medications. This is huge from a mental health perspective. Now, if you're severely depressed, medications are going to make a huge difference. It's going to be very hard to motivate yourself to exercise, but exercise is key for mental health. It's key for brain health. I am a 55, 40, 50, I'm aging myself, 54-year-old woman. And, in the earlier parts of my life, I exercised maybe around weight, all kinds of reasons why I exercised.
Mhm.
Now, the thing that's number one on my mind when I exercise is actually brain health. Um, because I have experienced brain fog. My brain works better if I exercise in the morning. So absolutely, and I am not alone in that. When you think about how your brain is going to work and being able to do your job, being able to raise your children, do community work, whatever it is you do, um, exercise is vital for mental health, for brain health. Exercise is vital for bone health. So for women, we lose 12 to 20% of our bone density during the menopause transition. 1 in 3 of us will have osteoporosis. And if you have an osteoporotic hip fracture, your chances of dying that year are 20%, and 50% will never live independently again. So weight bearing exercise in particular and strength training is key for bone health. Um, Exercise, building muscle is key for metabolic health. So preventing diabetes, it's key for cardiovascular health. So exercise really, it meets all those components. And when I think about the social piece, so exercising, being able to exercise with friends, with a community, whether it's going to a gym, joining a group, exercising with people online, or just going for a walk or playing golf, doing things with people that you care about, that's also going to help with the buy-in.
And the accountability factor too, right?
Oh,
Sometimes we don't
yeah,
have the motivation or the willpower. It kind of runs out, and
yeah.
having that accountability partner or community, of course, adds to the social aspect that is very important, but can help get you there too. So I think you've motivated me even further to make sure that I'm getting those daily walks in and getting that exercise. So thank you. Um, what when we're talking about hormone replacement therapy, HRT, making informed decisions with your healthcare provider, do you have any suggestions that you can offer for someone who, is it going to your family doctor as a first step? Or perhaps is there another avenue that we can take in the women's healthcare um, place that is now a little bit different, that is supporting us in different ways that a family doctor might not be as informed of? As you've mentioned, med school only provided a short amount. I know that Lume is supporting women's health, and I would just love to know a little bit about that and how you're doing something a little bit different from the traditional approaches to menopause care.
Um, I would love to tell you about Lume because that's our baby and we are very proud of it. I will also say that I have family doctor colleagues who are really great at menopause. Lots of them have taken the time to go out and do extra training. And if you're looking for one of those, you can actually look at the North American Menopause Society. You can look that up online for free, now called the Menopause Society, and you can see who is certified to be a menopause specialty practitioner. Whether they do that in a traditional family practice or in some kind of a specialty clinic, that's one of the things to look for if you're looking for evidence-based care at Lume. So Lume, we are Lume Women Plus Health. I have three partners. We came together. This has been a 2-year project to open, and we opened literally just a couple of days ago. And it was really about how do we develop a clinic where women can be seen and heard. And that's, there are a lot of constraints to our system about how much time physicians have. And patients come in with a lot of concerns and vulnerabilities. It's really hard to do that well. So we wanted a clinic where we really focus in on 3 specific areas and do that incredibly well. So it's not diluted by some of the other important issues that people come in with, but just not issues that we happen to address in our clinic. So we focus in on prevention. So, for example, preventing osteoporosis, cardiovascular disease, diabetes, those kinds of things. We focus in on menopause and perimenopause care, and we focus on pelvic health and sexual wellness. So we really want to do a deep dive. We want women to come in with their honest questions. We want to empower women with evidence-based information, and we want this to be shared decision making. So women are very health literate. They don't typically make decisions on a whim. They think about it, they read about it, they talk to their friends and their sister and their mom, and they want to make well-informed decisions. And we want to be a part of that decision-making process. And I would say the other thing that we care about passionately is advocacy for all women, whether we see you in our clinic or not. We want to go far beyond just the patient who happens to be in front of us. So one issue dear to our hearts is there is no menopause billing code in this country except for Manitoba. What that means is we haven't decided that menopause care, well, there's a diagnostic code, we haven't decided it's important enough that we actually reimburse physicians to give that kind of care and get the extra education to do that in a very agile, competent, and compassionate way. So we have been advocating for a nationwide billing code for menopause care. That is going to move the needle for women having access to care.
That's so important and something that I had no idea about. I'm sure, the listener might be a little bit shocked like I am. How can we support this advocacy work? How can we, you've mentioned we're half of the population. How can we get behind this to support physicians who do want to be helping their patients with this? What can we do?
Um, Great question. And we've been talking internally about how do we get a campaign together. We don't have a campaign yet, but I would say to begin, the more we talk about it and to spread the word so that it's on the radar. of our provincial governments who are administering healthcare. We need, and I suspect they don't know either. Everybody I talk to is shocked that this couldn't be on the list. But I think we need to think about menopause care. This is a critical developmental point for women where their risks, for example, of cardiovascular disease, mental health, osteoporosis go up significantly. And it's just like other periods in life where we actually do have different billing codes that allow physicians to spend the kind of time that is required to do good work. So, for example, if you go in with your toddler at 18 months of age, we know that that is a critical time to assess for autism, assess for speech and learning delays. And we can bill a different code and we have different developmental assessments that we review with a parent and child. We need the same thing in midlife. So please talk about it. Talk about it on your podcast. Tell all your friends.
Absolutely. Well, first and foremost, congratulations on opening Lume and dedicating this part of your career and a huge part of your life to improving mature women's health in just so many ways. The private women's healthcare clinic Lume is just one beautiful step in the direction that women really, really need right now to support them and really thriving in this stage of life. You also are a huge part of the platform. It's Our Time Canada. And so the listener, you can check that out on Instagram and online as well. It's Our Time Canada, where evidence-based health information on perimenopause and menopause is shared. So can you tell us more about this? How we as women of various ages and different stages can advocate for ourselves in more ways and discuss the health and as well as, these different stages with our healthcare providers, with the members of parliament in our community and just with the people that we love in general. What can we do?
Well, I would say please log on. We give really good, digestible pieces of information. For example, it was not too long ago that they lowered their provincial screening for mammograms from 50 to 40 years of
Yes.
age, which is a wonderful thing for all women. So sign up for your mammogram. If you're 40 and above, that is always covered by OHIP. That's really important. I think women are a really powerful group. They talk to each other. We pass along health tips. So the more we can do that, the better. It really is meant to focus in on the important pieces and to maybe do away with some of the noise. I think um, there's a lot of fear mongering. I think there's a lot of products out there sold to women that are not science backed, and it makes it very difficult to know how to make a decision about what's best for your health. So we try and be very to the point, and there's always science to back it up.
Right. So definitely check out It's Our Time Canada to stay informed on the evidence-based information that you're sharing. Thank you for doing that. If there's one key takeaway or something that's, a change or an advancement in menopause care that you're really excited about, or something that you really want the listener to take with them as we're going to close out this episode about navigating perimenopause and menopause, what would that be?
I have so many. I'm really thrilled that women want better and they're speaking up for themselves. This wasn't always the case. So I would say to continue to do that. Um, there is a new drug that was just approved in Canada a week ago, which is very exciting. It's called fezolinetant, and it is the first drug approved in Canada, which helps with hot flashes for women who may not be a good candidate for taking hormonal medications for a variety of medical reasons or personal choice. You can't yet get it in pharmacies, but it's approved. This is a big step forward. It has been approved in other countries, for example, available in the US for a few years. This is a huge step forward. Um, if you're looking for your own care, obviously we're very happy to see you at Lume. But one tip, if you call your family doctor's office, let the secretary know what you're booking an appointment for. That is to talk about perimenopause or menopause. And it is important enough, make it the one and only issue that you dedicate that time to.
Great. That's a great piece of advice. We know that our physicians have a lot of things on their plate, so giving them a little bit of a heads up for that conversation, I think, is a great first step. I'd like to ask all of my guests a question about how they're, putting themselves on the to-do list and taking care of themselves through authentic forms of self-care to better manage the juggle and feel a little bit better balanced in their lives. So, as a person who's wearing many hats, a mom of four, um, um, doing so much advocacy work and supporting women in so many ways. How are you, Sarah, taking care of yourself? And what is it that you love to do that's supporting you in all three of the areas that you've been talking about today?
That's a big question, and I would say, like all women, some days are better than others. Some
Mm-hmm.
days there's more balance, and I think the biggest thing that's come with age for me is I try and be kind to myself and not judge myself as harshly as I would. So if it's not, I'm going to have days that I make really good choices, and days where it's harder to get that exercise. Um, I think I'm always grounded by being around my boys. They remind me of what's really important. They're really good at poking fun at their mom and each other and at laughing. And that's really good. That's really good for me, to be a part of it, that not everything has to be serious. They have a pretty serious job. So when they're making fun of me and each other, that's actually a really great thing. It's always done very affectionately. Um, the one thing I really love to do is running, because that is meditative. I get outside, I run outside, I can just think, I listen to music, I listen to a podcast. I'm in the outdoors, and it's probably the only time in my life that I don't feel um, tied down to being able to answer multiple things and multitask. So I would say that's, for me personally, like having the opportunity to get outside and run is an amazing thing. My husband always says, he says he can look at me when I walk in the room. He's like, "Did you go for a run?" It's like, "You look
Mm-hmm.
different." Because he can tell I feel like a different person if I go for a run. Yeah.
100%. Yeah, I know the feeling after yoga. That's how I feel. And it just elevates my mood, my energy changes. And yeah, there's definitely a shift in how I view the world and how much patience I have for my family and the things going on in my life. So I appreciate that you're being kind to yourself, that you're giving yourself the grace that you need, but you're still carving out the space and the time that you need to have that time for yourself. Sarah, it's been such a pleasure. I really appreciate all of the information that you've shared and the time that you've shared with us. Thanks so much for being here on the Juggle is Real.
Thank you for championing women's health. It's really important what you're talking about, and we're grateful. We're grateful that you're making a space for this.
Well, I'm leaving this conversation feeling a bit more empowered, feeling like I have more information and a bit more knowledge to support me. And I feel comforted knowing that I'm, in this next stage of my life with people who truly care about women's health and the things that we are going through during these stages. I'm truly so grateful to Dr. Sarah Shaw for spending this time with us. I've included links in the notes for this podcast episode on Lume, how you can get in touch with this brilliant private women's healthcare clinic. The links for It's Our Time Canada, where evidence-based healthcare information on perimenopause and menopause is shared, as well as a direct link to the Menopause Society. So you can look and see if there might be a medical practitioner in your area who is informed and educated and has spent time learning more about the subject. As always, I invite you to share this with a friend, a colleague, someone in your life who is in this stage of life as well, to support them and help empower them with information and tools to better enjoy this stage of life. And if you enjoyed this episode, can you do me a favor and rate it? Write me a short review in Apple Podcasts so that others can find it as well. And of course, make sure you're subscribed. Come on back. We've got lots of great episodes to support you in the juggle of life. Until the next episode, take good care.